I'm Melissa. I was diagnosed with triple-negative breast cancer at the age of 33, and I went through my journey at Western Health.
And I'm David, and this is our son Louis.
The oncology team itself are a different breed of people. They are the most empathetic people I've ever crossed paths with. They can really empathise and put themselves in your shoes and actually understand what you're going through. And then there's so many allied services that you're aligned with, whether it be psychologists, social workers, which is what Western Health provide. And then you've got your breast care nurse, Sue, who was so instrumental in my journey. Any question was never a silly question for her, and she's walked that path before with many other patients at Western Health. And she was really phenomenal in getting me through that mental space, because it is quite daunting when you don't know who to lean on, or can I ask that question, or is that a silly question, or you have those thoughts at night time. I knew I could lean on her.
For Melissa, it was a difficult time because she's young with a young family. So it was around that whole emotional support as well. But just being there to answer those questions that for a young mum can be quite overwhelming and reassuring. My role in the breast care team, I'm one of two breast care nurses, myself and Claire, and we really act as care coordinators for our patients. And mainly it's really just as an anchor or a support person for them to contact us, to have that one person that they can contact. So it removes that stress of having to navigate the whole hospital system.
I'm one of the breast care clinical nurse consultants here at Western Health. In 2023, I was lucky enough to be awarded the Western Health Foundation Breast Care Nurse Scholarship. The Breast Care Nurse Scholarship is incredibly important. It really provides nurses with opportunities to access further studies which they otherwise probably wouldn't have access to. For me, I think the most meaningful part of our job is when a patient might finish their treatment and we see them in clinic once they're sort of all done and dusted, and they say to us, thank you so much, you've really helped me, or, I wouldn't have been able to do this without you. That to me is the most rewarding part of this job. Those moments do make you a little bit emotional as well, knowing that you've impacted a patient in a positive way. It's a privilege to be able to be involved in the patient's journey.
I think most days we actually walk away from a consult where we feel like we have made a difference. I think we're in a very fortunate position to be able to support patients through this time. Just last year, for example, 2025, we saw around 240 new patients. Personally, for me, just a big thank you to anybody who contributes financially. The smallest contribution may pay for a taxi voucher. The largest contribution might contribute to lymphedema treatment or a wig voucher. So any contribution, large or small, really goes a long way in helping support our ladies.